One of the Harper government's global initiatives has been improving maternal health in places like Africa. But Canadian NGOs there say securing government funding has been difficult in places like Sierra Leone, where the locals rely on birthing huts. They're a safe haven for pregnant women, especially when hospitals aren't close by. Here's Jayme Doll.
Due any day, she waits contently to give birth to her third child.
I get tired walking 2.5 miles, but the expectation that I'm coming to a safe place makes me feel happy.
Harding, just one of dozens of pregnant women traveling from distant villages to this birthing hut, also remote but much closer than the nearest hospital. It's equipped with supplies, beds, and nursing staff.
Now, the childbirth has become easier for them. The distance to cover is easy, and they can come here when they are sick, even if not pregnant.
Women will often spend days walking through the jungle before reaching river crossings, including this one, before they get the help they need for a complicated birth. And remember, they're doing this in full labor.
Canmore's Cause Canada has set up 20 birthing huts around Sierra Leone. Pregnant women can now come and stay here well in advance of their due dates. If the women are deemed to be high risk, transport is arranged to the nearest hospital.
In a country like Sierra Leone, women will die of hemorrhaging. They'll die of obstructed labor, just being endless hours in labor and not being able to deliver that child. And in Canada, very quickly, one would do a cesarean, and here you would just die.
It's clear from the warm welcome we received, the women are grateful for the facility. Operational for 1 year, the village is bustling with new arrivals. It's a positive sign in what has been a desperate situation. Sierra Leone has one of the worst mortality rates in the world for pregnant women. According to the World Health Organization, 1 in 8 will die during childbirth. The head nurse at this hut says in the last year there's been 1 death in 75 births.
So the question is, how many people didn't make it? How many women started on that road to go to the birthing hut and didn't make it? But of those who reach at least this birth waiting hut, they call it, and those ones do survive.
In the past, NGOs like Cause Canada have relied on millions of dollars in federal funding to support programs like this one. But they say it's becoming increasingly more difficult, and their funding from CEDA has now dried up.
Since Stephen Harper has formed a majority government, not just my organization, Cause Canada, but civil society organizations across the country have had a harder time securing long-term commitments and or even renewing the contractual relations we've had with CEDA over even 40 years. So, yeah, it's gotten harder. It has not gotten easier.
Cause Canada is pushing forward, finding funding elsewhere, so that women like Harding can have a fair chance at bringing a new life into the world.
I think I'm ready to deliver now, and I'm excited.
In Mayamba District, Sierra Leone, Jayme Doll, Global News.